Okay, I'm on. Sorry, I was having all these problems with my feed, but anyway, I'm here. Hi. So mommies, I wanted to talk with you today because I've been promising that I would do this video for like the longest time, and I haven't, so now I'm doing it. So I wanted to talk to you about pain with breastfeeding. Most people have a lot of pain with breastfeeding at the beginning, especially when they have like cracked nipples. Okay, so I wanted to talk with you about our new product, which is the Nipple Bomb. And this Nipple Bomb, just to let you know, it's 100% organic, it's pediatrician tested, it's color-free, it's scent-free, it's super easy to apply, it's like non-greasy, non-sticky, and it has calendula, which is great for helping your skin heal naturally. It has coconut oil too, which helps to keep the wound or whatever you're treating so that it doesn't get infected, and has aloe vera to help soothe and bring comfort to whichever area we're treating, okay? So this is what it looks like. This is what it's like inside. Like I said, completely taste-free, scent-free, and color-free, so it doesn't stain. And it's not like, look, I can do this with it, and it's not gonna like just all pour out. Oh, how am I doing this? Can you see it? I'm doing this with it, and it doesn't just pour out because the texture of it is perfect to be able to spread on so that it's not too oily and so that it's not too sticky. So I wanted to give you some tips on how you can use this during pregnancy and after pregnancy and for your kids, because it's like my #1 favorite product. I keep it in my diaper bag. I have a few all around my house. My son calls it our boo-boo cream. So it's just all around perfect for everything. So before pregnancy, our nipples tend to get kind of very dry and sore and sensitive. So if you put it around your nipple area, it's great for that during pregnancy. And something else that I encountered during my pregnancy, because you have so much blood circulation. Did you know that in pregnancy you have 50% more blood than you would usually have? I had a lot of, you can't see it now, but I had like little moles that would kind of swell up. They weren't there usually, but during pregnancy they would swell up, and I would like cut them and graze them all the time. So for little things like that, so that you're not having to use medicated things, I would use our Nipple Bomb. Like I said, it's super easy to apply. I just put a little bit on here. A little bit goes a long way too, so a little tub like this will last you a long, long time. And you just put it on your skin, and it just absorbs very, very quickly, and it's easy to just spread along. And like I said, it's not gonna stain your bras or your clothes or anything like that. So that's what I would use it for too. If you have like dryness, a lot of people, instead of their skin becoming oily, they become excessively dry during pregnancy. So I would put it kind of like around any blotchy bits that I had in my skin. I would put it too on acne. If I would have like acne bumps, it really helped with that too. So that's during pregnancy. And then something else you can do during pregnancy is a couple of weeks before you have your baby. So all you would do is, I have my boob here so you can check out my boob. So what you would do is just apply a little bit of the Nipple Bomb. I'm going to pretend I'm not going to actually apply it on my fake boob, but if you just put it like around the area of your nipple, because the actual nipple area and your areola are what become the most sensitive when you start to breastfeed, obviously because of your baby's saliva, because of the latch. So if you apply it in the areola area and the nipple area, it's just going to strengthen that area, so there's much more resistant for once you become prepared for breastfeeding. And something else that you can do is, if you just grab a little bit more of a dollop of the Nipple Bomb, and then something else you can do is start to massage like this, doing circular motions like this with your fingertips, and this type of thing you want to do around your breast. And this, you can start to actually stimulate your milk ducts for milk production. So you can do that just a few days before you give birth. If you want to actually experiment with expressing milk, it's great to help you just as you're doing this, you kind of go back and in, and you can, it just makes it easier and smoother for when you're trying to start hand expression to help your milk come in there a bit quicker. So that I really recommend. I did a lot of that, and it helped a lot with my milk coming quicker, and also helped so that I didn't have so much pain when I first latched my baby in those first few hours of breastfeeding, where breastfeeding is so intense and your baby's like vigorously sucking. So that's what I would recommend there too. Like I said, take it to you for the hospital. You can even use it like as nipple balm. You can use it for your nails, because your nails tend to get kind of very dry, and I felt them just very hard. So it's great as a nipple balm. In fact, I'll put it on now so you see what it looks like. It looks kind of like a lip balm. And there you have a natural lip gloss to just add to your lipstick or just to your regular lips. And it really helps, because with that air conditioning in the hospital that they really rank it up, your lips and everything gets really dry. And now for your baby, it has lots of uses too. It's lanolin free, just so you know, so it's perfectly safe if your baby like eats it. You don't have to clean your nipple after every application, because it's perfectly safe for your baby to eat this. That's why it's pediatrician tested. And for your baby, when your baby is born, one of the first uses that I had when Isaac was born, all his little, I don't know what you call them, like your places where you have creases around your fingers, around here, around your fingers, around your neck, behind his ears, they were like super, super dry and flaking off. He was like almost like a little snake, and all his skin was like peeling off. So I would apply lots of the nipple balm, and it was perfectly safe for him. In fact, what I would do is I would grab quite a little bit, and he was so little that I was able to just give him a full massage with it, and it really helped with those flakes to come off quickly, and for his skin to heal also. So that was a really good tip for that. I also applied it on like mosquito bites, any cuts and grazes that he got from his like little nails, like they start to cut and graze around their face because their little nails are like little sandpapers. So I would put them on that too, and it helped the skin heal really quickly. He did get diaper rash a few days when he was just a newborn, so I use this as my diaper rash cream. So if you have babies that are super sensitive to like their diapers or wipes or anything like that, you just apply this around the the bottom area where they get that diaper rash, and it'll take it away right away, just within a few hours. Elizabeth is saying this, I love this, especially for rashes. Yes, it's amazing for rashes. And just anything, you can use it for anything that basically requires that you have like some sort of skin rash or skin graze, anywhere where the skin needs to heal or repair. This will accelerate that skin healing as really, really fast, and it'll prevent it from becoming like infected or anything like that. So this is like my #1 healing balm to use just in general. And like I said, I love that it doesn't stain, that it doesn't feel greasy, that it absorbs really, really fast. So those are just some tips that I can give you there in regards to pregnancy, being able to use it during pregnancy, postpartum, and also for your little kids and your babies. My son, every time he hits himself, he grazes, he calls everything a boo-boo. So he comes and show me, he's like, "Mommy, look, boo-boo." And I would put him this cream on, so now he says, "Boo-boo cream, I want the boo-boo cream." So we use it for that too, and it doesn't sting or anything like that, and he's able to apply it himself. So I just love my nipple balm. I experimented with a lot of different ointments and skin healing treatments and different types of what do you call them? like lanolin treatments and stuff like that. And after a lot of experimenting, I was able to come up with my own formula that kind of met the criteria that I had, which was that it didn't smell, that it didn't taste, and that it didn't stain. Because my major problem was that when I would apply a lot of those that have like olive oil or cocoa butter and things like that, both Samuel and Isaac, they would like straight away repel. They were like, oh, like obviously it must really stink to them, and they would not latch on. So I would have to wipe it off or wash my nipples. So it was a major hassle. So that's when I started to experiment with different types of oils and ointments, and I was able to come up with Mommy's Love Nipple Bomb, which is USDA organic. So if you've tried it, let me know what you think of it. What extra uses have you been able to find for it? And just wanted to share that because it's like my miracle go-to ointment. Bye, mommies.